Today is National Nurses Day, which gets underway or kicks off Nurses Week, which will end May the 12th. And as we have been reporting for weeks now, the coronavirus is disproportionately affecting communities of color, but it is also affecting physicians in many of those communities.
In some communities like Milwaukee, Wisconsin, 81% of the deaths were among Black people. Joining us tonight is the president of the National Medical Association, Dr. Oliver Brooks. Welcome to the show. Let's just give Dr. Brooks a moment. There he is. Welcome to the program, Dr. Brooks. Can you hear us?
Yes, I can hear you. Thank you.
Excellent. Thank you.
And please, doctor, tell us about the burden that's being placed on physicians of color. We don't often hear about that. And why are our physicians more at risk?
So we are not necessarily more at risk of getting COVID-19. We are there on the front lines as physicians. So we join all the physicians and the healthcare workers at being at risk. I will say this, I've had reports as president of the NMA of at least 2 physicians who were sanctioned for complaining that they did not have adequate PPE. And there was a concern that they might have been sanctioned more so than someone of the majority community, put it that way. So that is a major issue. I will say that somewhat of an underreported issue is that half of African Americans get their care from solo and small group practitioners. And right now, what is happening with solo and small group practitioners is that they are seeing a significant decrease in volume. People are sheltering in place, safer at home. So they are not going in, and they are therefore not having patients come in. So it's been a big challenge. A lot of them are not getting the PPP monies, and so they may in fact go bankrupt, and that is a very big concern. The other thing is that, as you've heard, African Americans tend to have pre-existing conditions, and those providers are worried that once this is all over, then they will be inundated with people who have not been seeking care. And what happens if you're not getting care for your diabetes, for your hypertension, for your asthma? You're worse. So when they come in after not having seen them for, let's say, 4 or 5 months, then they're going to have patients that need care, are in worse conditions, and their practices have been challenged. So we have some real challenges in the African American physician community.
So I want to make sure I understand what you're saying. Are you telling people to go ahead and go see those doctors for, other issues, that they should continue to be seeing their doctors?
So that is an excellent question. We've been debating that. So just like there's a phased reopening of the environment, I refuse to use the term economy because we need to not think in dollars, but in the lives that we lead. So the best thing to do right now is telehealth as best you can. And that's where there's another concern with the African American community. A lot of the solo and small group practices were not prepared for telehealth. At my health center, Watts Healthcare Corporation here in South Los Angeles, we were more or less able to ramp up from, let's say, a minimum of 5% up to maybe 80% in as little as 2 weeks. A lot of the solo and small group practitioners cannot ramp up like that. They don't have the infrastructure in place. They don't have the training. So that is a challenge. What I would say is this: as we get a better handle on COVID-19, better understanding of the risk, at that point, it will be good for patients to start going in and seeing their doctor. Right now, I would say call your doctor. Your doctor is available. They may have the ability to do telehealth, and that phone interaction or that audio video interaction is very helpful.
And doctor, let me ask you about this. We've seen story after story of doctors and nurses who are putting themselves up in hotels at the end of their shifts in order to socially separate themselves from their family and to protect them. What's being done to keep those doctors and nurses safe after the shift?
So, I'm really glad you brought that up because, again, we share that burden. again, with other physicians. So this is where it's a brotherhood or a fraternity sorority. So first of all, you protect yourself as well as best you can. I call it generalized anxiety disorder. Our primary concern seems to be, I guess that's a physician's mindset, is bringing it home to our families. So the best you can do is have that PPE, which is one of the concerns that I stated, and then use it properly, and then take all the proper precautions. So if you have to, think about it, if you have to go to a hotel instead of be with your family, what mindset is that? Then you're stressed because you're working hard, you're worried. In my lifetime, I don't ever remember working in an environment where I worried about the fact that what I may be contracting on a daily basis is something that could theoretically hospitalize or kill me and my family. So that is a whole new environment in which we work. So what is being done for those that are in the hotels? They need to have good communication with their family to keep a good mindset, because your mental status helps your physical status. If you're stressed, your immune system is actually reduced.
And really quickly, as we wrap up here, Dr. Brooks, just want to get your opinion. Different parts of the country, some are reopening, some are staying closed. Do you think it's too soon? What are your thoughts on reopening the country?
Again, a very good question. So there's evidence that there may be a second virus circulating. We only have 3 broad methods by which we can, what a friend of mine called train or tame this virus. Public health methods, which is the shelter in place, wash your hands. There are treatments, which goes anywhere from ventilators to oxygen to medications, and then a vaccine, which we don't have yet. So back to what you said, public health, I think we need to go slow. We need to do it by data and by the information that we have in terms of the community spread, how much is actually out there in the environment. The bottom line is, if I have to say as a physician, I think that a lot of places they're going a little bit too fast. I'd say better get it right than get it fast.
All right, Dr. Oliver Brooks in Los Angeles, president of the National Medical Association. We thank you so much for your time and for your expertise. You're welcome here anytime.
Thank you for having me. Thank you.